Hi dear students, a warm good morning, and today we are going to talk about a new topic on medical microbiology, the types of infections. If you come across your daily life, you have different types of infections, and all these infections can be categorized into different classes. They can be considered to be as primary infections, secondary infections, reinfections, focal infections, cross infections, nosocomial infections, iatrogenic infections, endogenous infections, exogenous infections, and sometimes as a latent infections. Now, when you see like this, you might find that it's quite complexing, but you can see what once you analyze each and everything, it's something which is easy. And today we're going to talk about these types of infections in details. Now, the first one, the primary infection. The primary infection is as the term implies itself, it is the first time when you are getting exposed to a particular infection or against a particular pathogen, then such an infection is referred to as a primary infection. And during a primary infection, your body has no innate defenses against the organism, such as antibodies against that will not be produced. And the first time exposure to a pathogen will lead to a primary infection. And later on, you can see that you might develop antibodies against them. Then you will overcome it with a better phase. And sometimes you can also see that vaccination before exposure to a disease works by causing your body to produce the antibodies, and those antibodies will help us to improve the ability to fight off a primary infection. Now, what is the causative agent of what are the causative agents of a primary infection? It could be anything. It could be bacteria, it could be fungus, it could be any virus. Anything when you get exposed for the first time, it is referred to as a primary infection. Now, what is a reinfection? If the same pathogen is infecting the host subsequently or many times, okay, then it is referred to as a reinfection. And what is a secondary infection? A secondary infection is now when you look at the term secondary, you will have a thing that is it a second exposure to the same illness? But that is not the case. It is not a second exposure to the same illness. That is, if you are getting reinfected by the same pathogen, then it is called as a reinfection. But in the case of secondary infection, it is also known as an opportunistic infection. It is an infection which a person will contract during or after the treatment of one infection, and normally when the person's immunity is being lowered due to the first infection, he might get infected by certain other agents, and that is a case of secondary infection. And since this is an infection which comes when the person's immunity is being lowered, or when the second agent is getting an opportunity to cause an infection, it is called also as an opportunistic infection. Now, this may be caused by first treatment or by changes in the immune system. And if you go to look into the examples of secondary infection, you can see that a vaginal yeast infection can happen after taking antibiotics to treat an infection caused by bacteria. So normally when you get some bacterial infection, you might take some antibiotics, and that antibiotic taking or the taking of that antibiotic might sometimes it will kill the normal bacteria which is present in the vaginal area. But because what happens is when the normal bacteria grows, usually the yeast in the vaginal area will be reduced because of the action of this bacteria. But when the bacteria are being killed by the antibiotics for some other treatment, what happens? The yeast in the vaginal area might grow unchecked. So that becomes a type of secondary infection. And another example that we can cite here is pneumonia caused by bacteria or fungi after having an upper respiratory infection like cold that was caused by a virus. So you are giving a treatment against a virus, but what happens when your immunity is lowered by the virus, a bacteria or a fungus can cause pneumonia. So that is a secondary infection. So secondary infection or opportunistic infection is the infection which is being caused by a secondary or a second infectious agent after or during a treatment which has been given for a first infection, and when the immunity of a person is being lowered due to the first infection. So I guess you got an idea of what is a secondary infection. And now we have the next one called the cross infection. Cross infection is the transfer of harmful organisms, usually bacteria and viruses, between people or pieces of equipment or within the body. Now, I give you some examples so that it becomes more clear. Sometimes you might get UTI infection from an catheter which was being used. Improperly sterilized catheter might sometimes give you infection, a UTI infection. Okay, you already have an infection, but using a unsterile or an improper catheter, you might get infected by something else. That is a catheter induced infection. So that is a case of cross infection. Or sometimes a surgical wound infection that may cause redness, swelling and pus. You might also have a surgical wound infection. That is an example. That is from a surgical instrument or something like that, you might get infected. Then infection related to the presence of a peripheral or a central venous access line. So when you are getting blood transfusion or something like that, or when into your venous line when you are having some access, what happens if an infection enters through that into your body? That is a case of cross infection. So infection which can be either occur between different people. Okay, another person is having infection and you're getting cross infected, or pieces of equipment with which you are using. That is a case of if that causes an infection, that is a case of cross infection. And you can see that all these cross infections are mainly being caused by microbes, and they can be transferred either by unsterilized medical equipment, either by coughing and sneezing, human contact, touching of the contaminated objects, dirty bedding, or prolonged use of catheters, tubes, or intravenous lines. So these all could lead into the case of cross infections. Another term which we come across in infection is a nosocomial infection. Nosocomial infection. It is otherwise referred to as a hospital-acquired infections. You can see that in the hospital itself, there are different areas where different people come and go. And quite often what happens, it will be patients and who visit a hospital, and they might leave traces of the infectious agents in the hospital also. So a person who happens to visit a hospital or who gets admitted to a hospital, he would get a infection from the hospital itself. So such is referred to as a hospital acquired or a nosocomial infection. And the transmission, it normally occurs via the healthcare workers, patients, the hospital equipment, or sometimes interventional procedures which happen in the hospital. And you can see that either pathogens or sometimes even their toxins can get involved in a nosocomial infection. Now, if it has to be a nosocomial infection, that infection must occur up to 48 hours after the hospital admission, and it can last up to 3 days after discharge. Okay, even after 3 days of discharge you can obtain, or up to 30 days after an operation also you can get a nosocomial infection. And in a healthcare facility, when someone was admitted for reasons other than the infection, if he gets a particular infection, now I'll tell you, a person is going for a hand surgery, okay, and the surgery is conducted, and further on, if he gets another infection, not on the hand but on certain other parts of the of his body, and after 48 hours of hospital admission, if he gets it, unrelated infection if he's getting from the hospital, then that is classified as a nosocomial infection. And the most common types of hospital induced acquired or infections is referred to as a UTIs, surgical site infections, gastroenteritis, meningitis, pneumonia. These are all some examples of the nosocomial infections. Now let's move to the next one called the iatrogenic or the physician induced infections. Iatrogenesis, it mainly refers to the term physician. So, when a physician is causing an infection or a disease to a person, either by a harmful complication or other ill effect by like medical activity, including diagnosis, intervention, error, or negligence, then it is referred to as a iatrogenic or a physician induced infection. Now, there could be different causes by which a physician can cause infections to you. Either might be due to his negligence or medical error. Now he's giving you a wrong drug, wrong dose, wrong route of administration, wrong patient, or failure to give a prescribed drug. These are all coming under iatrogenesis. Or sometimes it might be due to the presence of a malpractice. Now, sometimes he might avoid high risk patients, or some error or some levels of malpractices which he is carrying out at the level of diagnosis in the prescription of drugs or ordering unwanted tests. These are all coming under iatrogenesis. And sometimes you can also see that over medicalization of the ill health. Now, with the use of conventional drugs which have been available, even almost all the traditional healing techniques have been replaced by these over medicalization of ill health. That is also a case of iatrogenesis. That is unnecessary use of drugs or over use of medical drugs. That is also a case of what? Physician induced iatrogenesis, because the overtaking of the drugs also could lead you to some other infection or a particular disease. And sometimes when the doctor does not have any prior warning about the possible adverse drug reactions. Now a person might sometimes have allergy to a reaction, or and the doctor might not be aware. So that could be a case of another infection or iatrogenesis. Or sometimes two different drugs might interact in a way and the person might get and it might give you antagonistic reactions. So that is also a case of iatrogenesis. And sometimes you can see that what does it means? The misuse or the overuse of antibiotic drug resistance of antibiotics could lead to what? Antibiotic drug resistant bacteria in the persons. So these are all contributed by the physician. So they are all considered to be as case of iatrogenesis. So by the actions, any of these actions, now including the commercialization of medicine, if a physician is contributing to the development of a particular infection or ill effect within a patient, that is referred to as a iatrogenic infection or a physician induced infection. Now you might have a confusion, what is a nosocomial infection and how is a nosocomial infection different from an iatrogenic infection? Normally, in a nosocomial infection, it is defined as a localized or a systemic infection occurring at least 48 hours after the hospital admission. That was not present, and that disease must not be present uh, or incubating at the time of admission. If such a disease comes after 48 hours of hospital admission, even at least 48 hours of admission is needed, and if that infection was not been present earlier, then you consider it to be as a nosocomial infection. And iatrogenic infection is defined as an infection after medical or surgical management, whether or not the patient was hospitalized. So we will be continuing with the type of infections in the coming session. So thank you for now. Just do view the second part of types of infections. Thank you for now.